Good evening, everyone. Welcome to the University of Michigan School of Public Health Graduate Prospective Student Discovery Series. I am Mary Beth Carroll, and I work as the Assistant Director of Student Affairs within our Office for Student Engagement and Practice. My pronouns are she, her, and hers, and I hope that you enjoyed the introduction video sent in your reminder email from Dean Bowman. If you haven't had a chance to take a look at it, I would strongly encourage you to view his words for our prospective student audience. This evening's programming, as you can see, will focus on our Health Management and Policy Department. Now more than ever, the world needs public health, and public health needs people just like you. Tonight, we'll talk about a variety of different things, including the field, program design, what life is like at Michigan Public Health. During our programming, you'll have the opportunity to engage with some of our current students, faculty, and even staff. Please feel free to submit any questions that you might have throughout the chat box, and we'll also leave time for discussion and questions at the end. Here at Michigan Public Health, our mission is to pursue a healthier, more equitable world through research, education, and action. We all work together with compassion, innovation, and inclusion to create a meaningful and lasting impact. And when you really think about it, public health really is all around us. It's the quality of the air we breathe. It's the flu shot that you're probably getting at the pharmacy right now. It's the ethics of genetic testing, and it's even the creation of the policies that govern our healthcare system. If you hear about something in the news, it's likely that there's a public health angle to it, especially right now. So here's the common denominator. Everything we do in public health is about improving the health of people, but at a population level. Now, as a graduate of the University of Michigan, you would become part of one of the world's largest alumni networks. This degree will give you worldwide recognition no matter where life takes you. And as a public health student, you will join a top-rated program with a long-standing tradition of excellence. Our history started back in 1941 when the school was founded. This is where the Blue Cross Blue Shield was created. The National Sanitation Foundation was founded, where the flu mist was invented, and the polio vaccine was proven safe and effective. It's even where the first Earth Day was held. The University of Michigan and the School of Public Health have consistently earned top rankings for the programs and the resources that we offer. At this time, I'm going to turn it over to Dr. David Hutton. He's this year's admissions chair, and he's also an associate chair within our Health Management and Policy Department. Thank you so much for coming to learn more about our school and our community, and I wish you a great evening ahead. Thank you.
Great, thanks, Mary Beth. And thank you all for attending this evening to learn more about the Department of Health Management and Policy. So a little bit of who I am. I'm going to tell you a little bit about the department for the next 20 to 30 minutes or so, and we'll have plenty of time for Q&A here today, I think. So I'm the chair of our admissions committee, so I'm happy to answer any admissions questions you have later on today. I have some actual real-world experience prior to joining academia. I had some work in software and operations consulting. My PhD is in industrial and operations engineering. It's not in public health, but my research is very much focused in public health. And what you'll see is many of our faculty have academic experiences outside of public health, but public health is a very interdisciplinary area, especially health management and policy. And so you'll get a lot of that interdisciplinary academic kind of exposure, intellectual exposure in our department. I teach classes on healthcare operations modeling and cost effectiveness policy analysis. My research is very much focused on cost effectiveness of health policies, and I've provided service to the World Health Organization, CDC, Health and Human Services, in helping them think about how to allocate resources and prioritize things. I'm not the only faculty person in our call today. I'd like to introduce a few of our other faculty, staff, and students on the call today. I'll let them introduce themselves here in order.
Good evening, everyone. My name is Eben Dotson. I'm an assistant professor here in the department. This is my four and a half year of being in the department. One thing is I'm an alum of the program. I was a master's student just as well as you are potentially. I went through the program. I earned a doctorate from UC Berkeley. I worked in the field for a few years, and then I made my sort of stake and my claim in academia. And I really appreciate that you all are here on the call or here on Zoom. Two things in conversation as it goes on. One, I run a program called the Summer Enrichment Program, and it's a health professions pipeline program. The other one is I have a research collaborative called the Health Equity Leadership Pipeline Collaborative. And so if you're interested in health equity conversations, if you're interested in leadership conversations, kind of as we go through, I'm on the line and may jump in the chat things with you. Well, welcome.
Hi, everyone. I'm Shauna Smith. I am an assistant professor in the department and a brand new one at that. So this is my first semester on faculty here at HMP. Although I haven't come far, I was at the medical school in the Department of Psychiatry before moving over to this department. I am an implementation scientist, and my background is actually in organizational sociology. And so the whole focus of my work is in trying to get providers to essentially provide the correct evidence-based practices. And so one of the best things about being here at Michigan is I do a lot of highly interdisciplinary work and a lot of work that's focused, on really encouraging providers to change behavior. And we have a fantastic relationship with the medical school here, and some really great opportunities to sort of do real world implementation work as well as implementation research.
Hello, everyone. My name is Charlita Daniels, and I am the graduate program coordinator here in HMP. And I've been with the department for 10 years now, and I work with all the students on admissions all the way through graduation. And it is a pleasure that you are here, and I hope you learn a lot about our program, and I will see most of you hopefully in the admissions process.
Hi, my name is Tyra Sampson. Good evening, everyone. I am one of the staff members in the department, and I work closely with Charlita and David and others. I am the internship and applied practice coordinator, and I also help support our Griffith Leadership Center.
Hey, hi guys, I'm Mohit. I am a first year Masters of Health MSSA student here.
Good evening, everyone. My name is Michelle, and I'm a first year Master's in Public Health student here. Nice to meet everyone.
Right, and we'll have a chance to interact more with some of the faculty, staff, and students here throughout the evening tonight. So I want to kind of start with kind of big picture, what is health management policy HMP all about? And so our mission statement is to cultivate exceptional leaders who create and apply knowledge to enhance the health of individuals and communities. And our vision is to contribute through research and education and innovation to designing and implementing an affordable system to improve healthcare worldwide. We have several goals with our multidisciplinary curriculum. We want it to reflect current practice and current issues in the field. We want to integrate both management and policy together and bridge research and teaching and practice and policy. And you'll see this in a lot of the faculty and students and what you're doing. You're taking research and trying to implement it in policy. The classroom should be hearing about research that's going on and so forth. And in the end, we want to provide our students with the competencies they need to have successful careers. And we'll talk a little bit more about what successful careers might look like later on in this presentation here. But in the end, our goal is to have our alums hold key leadership positions in healthcare and in public health institutions and organizations in the US and around the world. We have several values in this department: integrity, excellence, learning, inclusiveness, collaboration, and equity. And you'll see that throughout many of the things that we're doing and talking about today. You think about an academic department, learning is as a key thing, but integrity and excellence, inclusiveness, collaboration, and equity are also key values that we aspire to in this program. We also really value leadership. The University of Michigan broadly is very interested in leadership, and our department specifically is interested in leadership. And you might ask, with so many students in the program, how can everyone be the leader? You think about this traditional pyramid, and there's the guy at the top who's the leader. Well, it's not necessarily the right way to think about leadership. We each lead within our own sphere of influence. So there can be actually multiple leaders. Each person has their own area of expertise where they provide leadership. And it's important for the students to understand that so they can grow and be those leaders in their own spheres of influence. And we want to help students build those leadership characteristics. We want students, of course, to be honest, but also really forward-looking, inspiring, and competent. And we are looking for students who will be leaders, and we want to help students to develop as leaders in our program. Our program has a couple of different missions here. We have a teaching mission, which you can see horizontally on this figure here, providing graduate education. And we also have a research mission, you see kind of going here vertically, to create new knowledge through research. And in the end, we want both of these things to improve management, policy, and practice, and influence health policy. And students can get involved in both these areas. Of course, all of our students are very much involved in the teaching mission, but if you want to, you can also be involved in this research mission of our department as well. And hopefully the research will tie into your courses as well, and you'll learn about the latest and greatest things happening. Michigan has a few things that kind of separate it from other institutions. We think that these are a few of the things here are that students come with a variety of diverse backgrounds that enhance the experience of the students in the program. Students are coming from all around the United States and all around the world. And that's a really important thing to think about, is what you learn in a master's degree program is not just what you're learning in the classroom, but it's what you learn from your peers. So it's really great to have that diverse background of peers from around the country and around the world. Your classmates will be, physicians and pharmacists, consultants, Fulbright fellows, law, medicine, public policy students, military officers, a wide variety of students with a wide variety of backgrounds. So it's an exciting place to learn and develop relationships. Even in a COVID-19 era, when we're not all in the same place, we really think it's still important for us to develop those relationships. And hopefully, when you come here, we'll have more in-person experiences than those. So a few other things about Michigan. It is a comprehensive experience where you're getting exposed to both the teaching and research. As I mentioned earlier, the curriculum is fed by the research, and again, the research should be keeping the teaching current. And we want this to be an opportunity for you to get the skills, but also apply them in practice. So it's not just the ivory tower theory, but learning how things are applied in practice and developing the skills you need to be successful while maintaining that in-depth understanding that you'll get kind of from the theory. You will be building lifelong relationships. We want to invest in your career. This is a professional program. The purpose of you coming here is to get a great career and develop your career, and that's what we want to help provide for you in this program. And alumni satisfaction and engagement are really important. Alums are not just people who sit out there and throw wads of cash at us. They are really invested in the program. They provide a lot of feedback to us, and they're very committed to the program. They want to help the entire program. They want to help each other, and they want to help our current students. They're very motivated and very interested in mentoring students, and that's actually a really valuable resource. And we really want to involve the students in our program. Students can participate in student faculty committees. We have student councils, and we get feedback from students on our classes as well. And we want to get that from our students because you are our customers, and we want to improve the program to make it work. So when you graduate, again, this is a professional program. Where do students go? Well, we'll show you some more immediate outcomes, but kind of more longer-term positions held by HMP alumni are, well, I'm not going to read all the lists here, but very high-ranking people. And as I mentioned, leadership is a really important part of our program, and we want students to get those great leadership positions in their careers. We want our students to be successful and be leaders, and historically, they have been very successful in leadership positions. So who are the faculty? We have a set of core faculty with a wide variety of expertise. I mentioned I have an engineering background, but we also have faculty, with economics and sociology and and finance, and a wide variety of kind of academic disciplines, which is important because public health and healthcare management is complex and interdisciplinary, and so it's important for you to understand all those things from this wide variety of academic backgrounds. All the core faculty are engaged in research and doing national and international service. We also have additional faculty who have joint or adjunct appointments, who are practitioners who also provide a lot of richness to the student experience in the curriculum. I mentioned alumni briefly earlier, just a few more details on the alums. And as you heard earlier, the HMP, well, the University of Michigan has the largest group of alumni kind of in the nation, and health management policy in particular is one of the oldest and largest organizations of its type in the United States. We have over 4,000 alums in leadership positions across the globe. As you saw earlier, many people in high leadership positions. And our alums are in all 50 states and over 30 countries. So we have alums, across the country. Of course, many of them are in Michigan and the upper Midwest, but we have a lot of alums in California and New York and Texas and Florida and Washington. So really across the nation. And so the Michigan, as people call our alumni network, the Michigan Mafia, they're kind of everywhere here. And but it's great to have those connections with alums across the nation and across the world. When you come into our program, you have several different degrees you can choose to get. We have a Master's of Public Health, and we have a Master's of Health Services Administration. We also have a PhD program as well. And there are also many dual degree programs that students can elect to go into. Many students, or some students, choose to get a dual degree with the Ross School of Business and get an MBA. Some students decide to get a dual degree with the Ford School of Public Policy and Master's of Public Policy, or some other things like epidemiology, other degrees from other departments within the School of Public Health. Those are really nice programs. They're not for everyone, but for some students, it's the right choice. Instead of spending 2 years here, you spend 3 years to get that extra degree. But so the third year is extra time, but it's certainly better than 4 years if you were to do them separately. So that dual degree program can be a good program for the students who are interested in that dual degree. There are a few other ones that I haven't listed here, but that's also something that might be of interest. Just a little bit about the curriculum in the program. There's an integrated curriculum across that MPH and the MHSA degree. It's designed for your success and give you exposure to both management and policy. We think that that's important. Let's say you want to go work in a hospital. Of course, we want you to learn all the great skills to be a good healthcare administrator. And you will need those skills in your kind of first position out of school, working in a hospital. But eventually, you'll realize that what you're doing in the hospital is not only informed by management, but it's also informed by policy. So if Joe Biden wins the election and decides to have Medicare for all or something, or redesign the Affordable Care Act, that is going to have an impact on hospitals and how they get paid and what happens to them. So it's important, if you're interested in management, also understand policy. Similarly, if you're really interested in policy and you want to go work for a think tank or the CDC or Health and Human Services, it's of course important for you to understand policy, but it's also important for you to understand management. And if you change Obamacare, the Affordable Care Act, if you change that, how are hospitals going to respond to that? It's important for you to understand that. So it's important, we think it's important for our students to understand management and policy. And that's something that it's not just the eggheads academics who say this, but it's our alums who have leadership positions who say it's important for graduates to understand both management and policy. We have a broad array of elective courses as well, and some flexibility within the required courses. So again, you have these 2 degree options here, the MPH and the MHSA. I want to make you aware of those. If you apply to our program, you do have to check off a box, I'm interested in the MPH or the MHSA. That does not lock you into one degree or the other. Our students can choose that degree once they come here. So you don't have to make a hard decision on which degree you want to select right now. But that's something you can choose later. But typically, the MPH is really focused on population health, and that might be really good if you're interested in working in Department of Public Health or in a policy-making sphere. The MHSA is typically more focused on managerial issues associated with healthcare institutions. That's good typically for someone who wants to go work in a hospital or for an insurance company or pharma or something like that. But there is a lot of overlap. Students who get the MPH can go work in a hospital. Students who get the MHSA can go work for a policy think tank. There is quite a bit of overlap in these two. So you're not necessarily locking yourself into, one final career path for the rest of your life. So a few, again, just to wrap up, a few unique aspects about University of Michigan's Health Management Policy Department is it's a blend of that management and policy. The alumni network is really strong, and the alums are really committed to our department. And finally, you have access to other schools at the University of Michigan. Some students choose to get a dual degree, but even if you decide, I don't want to spend 3 years here, I just want to get the MPH or the MHSA, you do have access to those other schools. So even if you're not getting the dual degree, you can take some classes at the Ross School of Business. And in fact, those are some popular electives for students. Or you can take some classes at the Ford School of Public Policy, the School of Engineering, or the School of Nursing, or Social Work. Those are available to you, and that's a really nice resource. Just a little bit about the curriculum. We cover a wide variety of things. I won't necessarily read all of these things, but again, I mentioned earlier, learning about healthcare management and policy, and it's really important to understand a wide variety of aspects of management and policy. So we're not just going to give you health policy. We're not just going to give you politics and law. We're going to give you accounting and quantitative methods and so forth. And also some breadth in public health. You're here at the School of Public Health. You will get some breadth in public health. And as you're learning here during the COVID-19 pandemic, that's actually valuable to understand a little bit of epidemiology and biostatistics. Overall, kind of big picture, we want you to develop several different competencies, some related to execution, so how do you actually do things. One related to transformation. Our health system has got plenty of problems that need transformation, and we want you to, when you go out into the world as leaders, we want you to transform the health system, improve it. And then people skills, that's important as well. And really all three of those competencies are important for health leadership. I mean, you could have the best transformative vision and great people skills, but if you can't execute, that's not going to be helpful. Similarly, if you can really execute and really have a transformative vision, but you can't work with people, you're not going to get anything done either. So anyway, you need all three of these things really to be a successful leader in the health sphere. And those are the competencies we want to help you develop in our program. In the program, you're learning a lot of theory. There is some practice in the classroom as well, but we also want you to get some real world experience as well. So the summer internship is a good place for that. It's between your first and second year. You'll have a preceptor who helps guide you and mentor you through that process. Most of the internships are paid too, so we're not asking you to work for free. Students intern in a variety of organizations and locations across the United States, across the world, and have a variety of responsibilities in those internships. And I'll say even during the, Tyra was in charge of a lot of this, and it was really stressful for her the last 6 months or so with the COVID-19 pandemic. There were a lot of changes to the internships. It was stressful and challenging, but I think we did really well, and all of our students, I think, have had successful experiences over the summer to have some real world experiences to complement their classroom experiences. And students go work in a wide variety of organizations. I will say also, I expect the internship organizations to be much better prepared to deal with interns in the 2021, 2022 years. So COVID-19 hopefully won't be as much of a problem for you guys if you come here as has been for our current students. Also, a common question is about financial aid. But half of our students receive scholarships, and the scholarships are both need and merit-based. Just a little bit about the admissions process. We're having this kind of prospective student day, kind of pre-application information sessions. Then you'll turn in your application into SOFAs. I anticipate that a lot of you being proactive, being part of this, we'll kind of flow through the application process into an interview or a virtual visit day. We'll have a virtual visit day to give you information about our program. We'll have an interview, so we'll look at more than just kind of your paper application and understand the complete student to see if our program is a good fit for you. This is a big commitment you're making to be with us for a couple of years, and so we want to make sure that what we can deliver for you is what you're looking for. And then we make an admissions decision, and then you make your decision based on what you know about us as well. So we want to make sure this is, again, the right fit for you. We also have an executive master's program. This is for students who have about 5 years or more experience. So that's something to think about. I think most of you are probably interested in our traditional master's program, but if you're interested in the details about this, please let us know and we can answer questions about that as well. That's kind of partially online and a few kind of long weekends on campus. In the end, I mentioned earlier, this is a professional degree program. We want you to have professional success when you leave the program. And I think our track record does a good job of that. Our students are very successful at getting jobs after graduation. And I think their salaries are pretty good. Our students go to a wide variety of sectors, a lot of them in kind of hospitals or healthcare providers, but many students go into consulting or health insurance or the federal government. And also, I think about 20-something% of our students end up in fellowships, and that can be a really great opportunity as well. With that, kind of to wrap up, I just want to say our coursework that you're getting, the internship, the professional development that you're getting in the wide variety of kind of student organizations and alumni experiences and so forth, we want that to be kind of put together to give you great career success. And with that, I think I've been talking for a while here. I think it's time for me to stop and open it up for questions for myself and for the students and staff. I see there are a lot of questions here. I think Tyra, it looks like Tyra has been answering. You guys have been answering a few of them. I guess I'll just go through the list here and start at the top.
Here's a question. So for someone interested in healthcare management, what's the difference between the MHSA and MBA in healthcare when making a choice between the two degrees?
So that's a really good question. And that's a good question because they are similar, right? The MBA in healthcare and the MHSA are similar. I mean, they're both designed, I think, for students who want to have managerial positions in healthcare organizations. I guess the few distinctions between the two are with the MHSA, we're coming from a school of public health, so you will have some of that public health, population health background to your education in our program. We've been doing healthcare management education for decades, and so I think we've got a well-worn path to how we want to educate students and give them exposure to what they need to be successful healthcare executives. But you also have that kind of population health, public health background, which is we're learning from COVID-19. I think actually is important. It's important not to neglect that. With the healthcare MBA, I mean, you're in a business school, so you will have more of that kind of business school background. So you might get more on HR and real estate or something like that, things that are kind of under the business school umbrella. With all that said, if you come to Michigan Health Management Policy, you can take some of those classes at the Ross School of Business if you think they're of interest to you. Or if you decide to go to the Ross School of Business, and you can take some of our health management policy classes as well. So there is an opportunity to get a little bit of both too, no matter where you end up.
And so for that, I also want to add, there was a question about how, when applying to both schools, or how does that work? And so all of the application and admission processes are separated at the University of Michigan. So if you apply you want to do a dual degree with any of the other schools, law, the School of Public Policy, Ross, the School of Business or Engineering, you have to apply separately to the programs, and you are admitted to both programs. And so you can decide to do a dual degree at that time once you've been admitted by both. One thing I will say is that the Ross School of Business does have a work experience requirement. And so most of the students who have been interested in the dual degree have been more successful if they're coming out of undergrad or have very little work experience by applying in the first semester of the of SPH. So in your first semester in the MPH or the MHSA. So that if you are considering applying, and you don't have a lot of work experience or you're still in undergrad, consider starting one program and applying for the other. That gives you the opportunity to take classes at the Ross School of Business, as well as you will have your internship completed by the time you would start at the other program. So keep that in mind. There was a question about, is it typical for students to pursue a dual degree with the law school? We currently have 2 students who are pursuing the dual degree with the law school. So yes, that is something that's common. We also have students who are doing dual degrees with the Ford School of Public Policy, the Industrial Operations and Engineering program, and in social work. So those are some other dual degree programs that are popular with our students. We also have students who do dual degrees within the School of Public Health. So we currently have 2 students who are doing an MPH in epidemiology and MHSA or MPH in health management and policy. So that's also a possibility if you are interested in 2 programs within SPH. All dual degrees are 3 years, so make sure that you are planning for that when considering the dual degree. And so the other question we have is about the Executive Master's Program. There's no internship required for the Executive Master's Program. And so the coordinator for that program is Caitlin Taylor. And so I will put her information into the chat box if you have questions about the Executive Master's Program. And so for you, David, we have a question about what kind of jobs do graduates fill within government?
So that can be a wide variety of places. Students can work for the federal government, state government, local government, wide variety of places. But I think people might go work in the State Department of Public Health, let's say, for example, as maybe an analyst for Medicaid or something like that, or the state, of course, has a variety of kind of specialized programs related to health and public health. Or they might go work at CDC. I'm working currently with one of our graduates who graduated in 2019. She's working at Health and Human Services in Washington, D.C., and we're working on kind of economic analyses of Medicare, infectious disease. So students go to a wide variety of places in government.
And then maybe Tyra, if you had an idea of what percentage of the students go on to a fellowship program?
That I'm not sure of. I want to say though, usually it's about at least 30 to 40% of our students.
Yeah, that sounds about right.
And then others will find full-time roles in health systems, hospital, government, insurance.
I think Tyra froze for a second, but so we do have about a third of the class, maybe a little bit more, is in the fellowship process every year. And so our administrative fellows have been very successful in the career trajectory. So we have fellows who, again, come out of undergrad or with a few years of work experience, do administrative fellowships, and are within 2 to 3 years in director roles or in moving pretty quickly up in their careers. So we can definitely, if you have questions about fellowships, we have some students here, and we have some second-year students who are currently in the process that we can connect you to. And then we have a question for you, David, about how important is it to have a work experience when applying to MPH and HMP programs?
Yeah, so work experience is valuable. I think it does a few things. I think it helps give context to what you're learning in the classroom. And honestly, Your other students will benefit, I think, from getting that experience from you and hearing about your experiences in the working world. But it's not required. And I would say, we have about half and half students without work experience, with some work experience, or actually a little bit more maybe with work experience. But it's not required, but I think it is helpful.
And so also, we have a few questions, but for you, David, again, so there was a question about, can you speak a little bit about the executive MHSA versus the full-time program? This prospective student is on the cusp of 5 years of experience, and how would you recommend which is the best fit?
Yeah, so I think both are good options. It just depends on what exactly you're looking for. So what we call the residential program, which is a little bit less residential this year than most, but the kind of full-time program, you're here for 2 years. You have an internship between the first and second years, and there's 60 credits that you're doing in that program. That's a really great program. This cohort size is about 60 or something students in the cohort, so that's about the size of the students that you're with. The executive program is a little bit smaller cohort, maybe 20, 25 students or so in that cohort. They're taking classes evenings and 2 long weekends a semester. So you'll come in like a Thursday, Friday, Saturday with full days of classes a couple times a semester. And if you're in the executive program, you'll be doing that the entire year. Fall, winter, spring, summer, fall, winter, spring, kind of the entire school year. So there's no internship in the middle. So it's a little bit different. I mean, if you want to be in a program where you're with other students who have 5 to 10 years of work experience, and you want to continue working and take these classes nights and weekends, the executive master program can be a good one. If you want to kind of take a break and really focus in on classes and not be working at the same time, and you want to try something new with an internship in the middle as a way to kind of explore a different career option or something, then maybe the residential kind of full-time program would be good for you. So it really depends. They're good pros and cons of each of those programs.
And so we have questions, and maybe our students can answer these. And these are about, what are the opportunities for collaborating between other departments? And do you have the opportunity to kind of specialize your degree based on your interests? So if you had an interest in food policy or an interest in operations, or is it possible to do that?
In terms of specialization, there's not more so a way, because this is one of my questions when I applied to Michigan, and you can't necessarily specialize in a certain thing. However, you can kind of cater your academics. Like if you're giving a project, for example, like in my policy class, we were given to write a policy memo about anything. I love maternal child health, women's health. So I use that as an opportunity to dive more into that aspect. So you can't necessarily tailor, like focus on one thing, but different projects and different opportunities, you can like get into different things. And in regards to collaborating with other departments, I think one major way to do that is through research. I know for me, like I said, I love maternal and child care health, and there's not really a lot of professors that do that work within our program. So I venture out into like the HBHE program and things like that, and connect with professors there and do research on things that may interest me through other departments. And another way could be through orgs. I know I'm involved in like the maternal child care health organization. I'm involved in other organizations that are not really tied to HMP, so I'm able to get that experience from someone else. So yeah.
Yeah, just to piggyback off of what Michelle was saying, there are ways you can get certificates and stuff like that. Specifically, I right now am part of the global health management policy cohort. So there's like a specialization. So I was interested in global health. So I figured there's like a specialized. So that is one way to specialize it. But a lot of the times it's just through your coursework, finding a way to like pick your interest in, like dig in deeper. That's one way to, specialize it.
Thank you both. And so we have a question about, are we at a disadvantage applying straight out of undergrad? Are there ways we can boost our applications, such as taking HMP courses during undergrad? So,
I think Michelle and I both nodded our heads. But I came straight out of undergrad, and I was pre-med like cellular molecular biology major. So I had zero experience when it came to like HMP classes. I had an interest, and so I mean I did some research on my own, but my coursework had by no means had any connection like with HMP courses.
Yeah, just to piggyback off of that, like I came straight out of undergrad into the program and I was a psychology major. So this was a whole different transition for me. I don't think I was at a disadvantage. I think I was at an advantage in the sense of grasping onto the material because I was so used to taking classes, exams, and things like that. So I could just carry those skill sets into our program. It helped me more compared to people that may have taken, 5 to 10 years off. They got to reboot in order to get back into taking quizzes, exams, writing papers, and things like that. So you're good. Why?
thank you both. I definitely don't think there's a disadvantage. You'll have plenty of company. We have a lot of undergrads, straight out of undergrads in the program, and a lot of students who have bachelors in public health as well. So that isn't an issue. In terms of taking classes, if it's natural, if you have room in your schedule to take a few classes, they're not necessarily H&P courses, maybe courses in statistics or accounting or, some quantitative courses, maybe econ. I think those would be helpful. Are there others, David, that you think students should consider or applicants should consider?
Yeah, I mean, I guess I'll say when I'm looking at student transcripts, I'm looking to see, do I think the student can be successful in our program? And our program is pretty interdisciplinary, but some of the most challenging courses for students are quantitative courses. So, and actually we don't require the GRE, but we do have a question about how we want, where you can explain your background and experience with doing quantitative work. And I think that is important for our students to develop those quantitative skills and not be afraid of quantitative analysis. And so I want to know that you are comfortable with quantitative analysis and that you're willing to learn and do that kind of analysis. So like Charlita said, classes in statistics or accounting or economics, I think typically those can be good signals to me as someone evaluating applications that this person is capable of doing quantitative analysis and willing to do that.
Definitely. And so we have some guests that have already applied, and they're asking what's next. So, and what is the difference between the interview stage and the visit day stage?
Well, in the past, when we were allowed to have in-person events, we would have students come on campus for a visit day where we would interview them. That's probably not the best process to have here in winter of 2021. So the plan is to have a virtual interview and then a virtual kind of visit day where you'll hear more from students, and really the interview is kind of more one-on-one, where you can have a one-on-one experience talking with the faculty member, and the faculty member can tell you about the program as well directly. And the visit day also is an opportunity to interact more with both faculty and students. And that's a good opportunity for you to get a sense of if Michigan is the right place for you. Obviously, tonight is a good opportunity for that as well, but the visit day is another opportunity.
And I will answer this question about, is there a core curriculum at SPH? Yes, there is. So there is a core curriculum because we're in the School of Public Health and accredited by the CEF. There is a core group of courses that every graduate should have some exposure to. And so if you're doing an MPH, that would be biostatistics, epidemiology, there's nutritional sciences, environmental health sciences, and what's the other one? I said biostat?
Health, behavior, health education?
And health, behavior, health education, yes. So you do have courses across all of the departments in the school. MHSA students take epidemiology and biostatistics as their SPH core requirements. And we also have an HMP core that is of required courses. So you have to cover courses in management. You have to have a course in operations, econ. So there is a list of core courses that you have to take for the MPH and the MHSA in HMP as well. And I can put the link to the describing the SPH core curriculum into the chat for you. And so the next question we have is, what are the most unique classes the HMP program offers? I would think one of the most popular courses that we have is a transformational leadership course with Joe Horton, who is a CEO he at Intermountain. Do you remember, David? And so every year he does a short course on transformational leadership, and it's very popular with the second years. We have courses in case competition, so that's taught by Dr. Dotson, who you heard from earlier. And others, if Tyra is here, I'm trying to think.
Capstone.
Oh, right. Oh, yes. Capstone. So we have the Integrated Learning Experience in Health Management and Policy, which is our capstone course. And that is taught by Matt Comstock, who also teaches our financial accounting for the first year students. And he is the COO of the Michigan Medical School, and a graduate of the program. So he is definitely very popular, and the capstone is a semester-long project that you work on in a group, and you have a real-life client, and you provide a deliverable at the end. So that is very popular. Thank you, Tyra. And others, for Michelle or Mo, have you heard?
We're just starting, so I haven't heard much, but
Right,
I
okay.
will tell you the one class that I found really beneficial was our case competition class. And we haven't really talked much about it, but this is really an opportunity to kind of put into practice everything you're learning in class. So we're giving like an issue within a hospital or a problem within a hospital, and then we're tasked to find a solution. So maybe a hospital is like drowning financially. How can we help them rebuild and come back up? Developing plans and things like that. So I feel like if you don't take any class, take that class. It gives you a lot of real world experience. It kind of shows you what it's really like to be in the hospital and be on the job. So, yeah.
Thank you, Michelle.
Let me just say, too, there are good classes in some really kind of unique ones within health management and policy, but also there are unique opportunities outside that. So there's some, again, good classes at the Ford School of Public Policy or Ross School of Business or engineering or social work, things like that, that are quite unique and different from what you might see in some other programs.
Yeah,
Sure.
just like what Dr. Hutton just said, and Michelle, I took an elective right now at the Ross School, and it was on innovations in different health care delivery models, which was cool because it was in the Ross School, but it definitely had a lot of like connections with public health, and so it was a nice way, and it wasn't focused completely on the United States healthcare system, so we got to learn about different countries. So that was also a class that I would say was really unique.
Thank you. And so that leads us to our next question about, are the core courses focused primarily on healthcare in the United States? And is there an opportunity to learn more about low and middle income country health systems as well? This feels like a plant because we have two faculty members who actually teach courses that are specific to public health in low income countries and public health in high income and middle income countries. So those are two separate classes. So if you are interested in either, and they're a part of the Global Health Management and Policy Program, so the GHMP, and so you would learn about both. So that is definitely offered here in HMP. Do we have any other questions? I see one here about what is the time period between application submission and interview invitation?
That can be a little bit variable. You submit your application, but then SOFAS double checks your transcript and got to get all the letters of recommendation in and all that kind of stuff. So that can be a little bit variable. I mean, I think it could be as quick as maybe 3 weeks to a month or something like that. Charlita, does that sound about right?
Yes, it is.
That might be kind of a good rule of thumb. It could go a little bit longer though if you're applying from an international location and the transcripts take a long time to get vetted and things like that. If you're having any trouble though with the process, and please let us know. We want to make sure that we work out any kinks if a recommendation letter didn't come in or something like that.
So to answer one of the other questions that was asked, where do you go to if you have questions about HMP admissions? Who should you talk to? And so if you have questions about the process, you can contact me on hmp.admissions@umich.edu, which I will put into the chat for you. That's where you can ask the questions that you have that are specific or unique to your situation. Okay.
I think there was a question earlier on in the chat about what we're doing with the pandemic.
Yes.
And we're doing kind of a variety of things. Many of you maybe read in the news. The University of Michigan has kind of shut down a lot of the undergraduate dorms and all the housing arrangements and a lot of the undergraduate classes. We'll see how things evolve for our graduate students as well. But I will say right now we're doing something we call hybrid. So a lot of classes are completely remote where you're doing things via Zoom. But there are some classes that are what we call hybrid. So you have the option of coming in if you'd like. And there are a few kind of, if they're a smaller class, they might be held in person. If you'd like, all classes have the option of remote learning. I'm currently teaching a hybrid class, and just a handful of students will show up in the classroom. Most of the other students are electing to do that online. I think it's going reasonably well. But it'll be interesting to see. That's kind of the plan, I think, for the winter semester here in 2021. Now, fall semester 2021, it's uncertain exactly what that'll look like. I've done some research in pandemic policy. I'm following this very closely. There's still a lot of things that we're uncertain about. I think there are some things like vaccines that potentially could influence the fall of 2021. Better testing. The University of Michigan just switched to saliva testing for surveillance in the last week or two. I think if we get more and more of these kind of rapid, easy to use tests available, that might change our ability to have more in-person events in the fall of 2021. These things are very uncertain. None of us can make any guarantees about exactly what the fall 2021 will look like. But I'm optimistic that we'll have more in-person experiences as time goes on, and by the time you all would get here in the fall of 2021, I think we'll have more opportunities for in-person experience.
See, the other questions we have, are there mentorship opportunities that match first-year students with second-year students or alumni? And I know we have a current first-year class rep in the group, so maybe she can let you know about that.
Yes, we do have mentorship opportunities. So once you join, once you come to Michigan, there is like an application process. We kind of submit what you're looking for in a mentor, characteristics, and we're going to pair you with someone of your same interest. So I have a current mentor who's a second year who's very aligned with what I want to do. So it's really helpful to go to for advice and when it goes to career options or networking and connecting. So yeah, we do have a mentorship process.
And then there's also opportunities to network with alumni. And so that's a part of what Tyra mentioned earlier. She works with the Griffith Leadership Center, and that is where alumni are brought in to do talks, and you will have opportunities to connect with an alumni mentor as well. And so there are a lot of opportunities to meet and connect and, be mentored. So definitely consider that when you are planning or deciding on a program. What are the opportunities to meet those in the field, and how can they help you with your network, essentially?
So just to speak off of that, so for me, that was the biggest connection why I chose Michigan, was the alumni network. Like how Dr. Hutton said, Michigan Mafia, it's for real. I'm not the best at networking, and when I was going through the process, everybody was talking about, our alumni network. But I've networked, I think, 3 or 4 times, and the Michigan alums are very, very easy, and they want to talk to us, and they want to help us out with any way they want. So That was something someone like me who not comfortable or not that well at networking. It was really nice to see.
And by no means are you, we expect you to come in, networking pro and have all the contacts and have the skills to, navigate your way to the CEO position by, the second year. It's not possible. What it is an opportunity to build that skill. And so we have a professional development requirement. And so as a part of professional development, this is where you would learn how to do your elevator speech and your 10-second preparation and what strengths you have. And so there are things built into the program to help you develop these skills. So don't feel that you're at a disadvantage if you don't, currently have, you're feeling like Mohit just said, I'm not sure about, I'm not the best at it. It's okay. So we have all levels, skill levels in the program. And so there was a question. So for anyone else, if you didn't see this or asking about the dual degrees, I just wanted to emphasize that the University of Michigan is decentralized. And that means that every school and department is probably doing their own thing, right? So you could apply to, multiple schools and colleges. That doesn't mean we know about it. We don't. So if you are applying to the School of Social Work and you're applying to HMP, for example, through SOFAS, you would have to participate in those processes separate. So you get a decision from the other school college program and you would get a decision from us. You decide which school college program you're going to pursue, and that's fine. Okay, so, and there are different deadlines for programs. Our deadline for saying, yes, I really think I'm going to come here is usually in April, mid-April. So, and again, there's support through this process. So if you are invited to enter an interview and a visit day, we will be talking to you a lot more through the process. So you will have more information. So, so just know that is there. That's what the visit day is for, to get more information. Are there any other questions? We are at about 7:05, so we're at our hour, and we don't want to keep you any longer. And I will tell you, if you have questions, please email me at hmp.admissions, and I am putting that in the chat right now for you. And do you have any last minute questions for Professor Hutton or our students?
I had a question.
Sure.
In terms of the personal statement and applicant, what makes a strong applicant? What makes a strong personal statement? What are you really looking for in that application?
So in the personal statement, I'm looking for someone that's a good fit with our program. So, and I'll say what I'm looking for in the application, big picture is, can this person be successful in our program? And, are we the right program for them in what they want to do with their career? So someone says, I want to, grow crops to feed the world. That's not our program. You should go to agriculture. And it would be a huge waste if a student says, if they came here and they wanted to, be the best agricultural scientist and they came to our program, it's not a good fit. So we want to make sure that, what you want to do really is in line with what we're providing in our program. And, also we want to know that you can be successful in our program. So we want to know that you have the kind of background and skills that will allow you to be successful in our program. That a little bit of that will come out in the personal statement, but the transcript and things like that are also where we look for that as well.
One piece of advice I will give anyone who's applying, when you're thinking about writing the personal statement, make sure your personal statement is visionary and not reflective. And so the visionary, you have decided that public health and health management and policy is your career choice. So going forward, not what happened when you were undergrad, not what happened in high school, not what happened when you were 7. What is your goal? What do you want to do with this degree? How can we help you achieve those goals? What do we offer that you need and that's going back to Professor Hutton's, the fit. Okay, so that is very, very important in a personal statement. That is a visionary statement. Okay, so you're thinking about from today and 5 to 7 years out, what do you want to be doing? Okay, so just think of that. There is an opportunity on the SOFAS application to do a reflective essay. It's a very short 500 words, and it's about how do you contribute to the community, SPH community, or something like that. And so I would suggest, if you want to reflect, do it there. So if you want to talk about, this is the past, and this is what I did, and this is what I'm bringing and contributing, perfect place to do it. And there's also the place where if you've had any sort of anomalies in your academic record, one sentence, I didn't do well, fall of, whatever the reason, 1 to 2 sentences, that's it. In any application review, we can see it on your transcript. Okay, so you don't want to go into great detail. You want to focus on today and forward, visionary, strong statement. What does each program have that you need to be a successful public health and health management and policy professional? Okay.
Yeah. And I'll just to add on to that, I think you can tell us what's happened in the past if it informs how you're viewing yourself in the future and what you want to do going forward. And we have, by the way, we have a ton of students who, like Mohit said, were pre-med. They maybe thought they wanted to go in one direction, and they realized, oh, actually, I want to go into more health administration, health policy. That's totally fine. We want to know, if your past informs your future, that's great. But you might have been a philosophy major, and then senior year realized, I see the light. Health management and policy is where I want to be. That's fine. But tell us about that vision that you have for what you want to do going forward, because we want our program to feed that vision and that future career that you have ahead.
Awesome. Thank you both so much.
You're welcome. Okay, well, thank you very much. And thank you to Mary Beth Carroll and the Office of Student Engagement and Practice for giving us this opportunity to talk with you today. We will have more webinars at other points throughout this semester. And for those of you who have applied, please, if you have questions about SOFAS, contact the sph.inquiries email or contact the OSEP office, because they have all the policies and procedures related to SOFAS. And so I don't want to give you incorrect information around verification dates and transcripts and letters of recommendation, etc. So please use SPH admissions for that. But if you want or have a question specific to our program or our admissions, considerations, please contact me at hmp.admissions. And I did put that in the chat for you. And so again, thank you very much. If that is all. And we hope to see you at a visit day or an interview sometime in the future. Thank you.
Thank you very much.